Hi guys, welcome back to my channel. I am Dr. NGM, Dr. Njoku Clara Martins, NGM for short, and I'm currently doing my housemanship, that's internship. I am currently in week 21 or 52 weeks of housemanship. I'm literally in the middle, like I've gone half of my housemanship. So apparently, yeah, you have 48 weeks to do your housemanship, and the remaining 4 weeks is supposed to be for leave. So you're expected to take 1 week leave or 1 week break after each rotation. I just recently finished my surgery rotation, and although I didn't take any break because I didn't just see the need for it, honestly, I just want to do all of this and be done with it. Do you get? I don't want to have to take any pauses in between. I don't know. I have the adrenaline right now, so let me just keep going and just be done with it. I can't wait, in all honesty. So I have literally been surviving. This is my week 21. I am currently doing my pediatric rotation, and I recently just finished newborn rotation. I've done children emergency rotation. I have done newborn rotation. I am back to the ward. And I was on call yesterday night. I was on call and it was a very busy one actually. There was a child that is being managed for that has heart failure secondary to VSD, that's acyanotic heart defect, and well, the child wasn't doing so well, and she has, on top of that, she also has bronchopneumonia. So we had to monitor the child closely and be sure that she wasn't depreciating or anything really. So yeah, it was actually a long night. The stress was much. Plus, you have two wards. You have upper ward A and upper ward B, so you have to be shuttling between the two wards to give your IV medications and to check up on your patients. And well, let's just say we survived the night literally. So if you're new to my channel, do well to check out my videos. I've made tons of videos to help medical students, or if you just finished medical school and you're planning to start your housemanship, maybe this could give you a little insight on where to possibly do your housemanship. Yeah. So just a little advice for those of us that want to start our housemanship. I know a lot of schools have graduated a lot of doctors, yeah, and some of them would be wanting to get into their housemanship. The next step after graduation from school is housemanship, except maybe you don't want to do your housemanship. Well, you have to in order for you to get your permanent license. So it's usually important that with the new structure of the MDCN, where you get to select a center, like they upload centers, and you get to select a particular center for your housemanship, it's actually good to have more than one center in mind. Note you, housemanship is just for a year. I'm saying just for a year. It's a long time of experience actually, but like it's not that long. Do you get what I mean? Anywhere you see that you could do your housemanship as quickly as possible, just do it and continue your life because you're not going to be there forever. You get, you're there for a year as a house officer, as an intern. So why not just do it and get along? Except maybe you have your means and your ways to get to the hospital of your dream, fine. But when MDCN uploads the hospitals that are available for you to select from, they are not going to tell you, oh, we have one more center available, or you may not even see the hospital you want to get into. You get, I advise you to join centers, to join housemanship centers, portals on WhatsApp, so that you can get updated information, so that you can be well educated, so you can get the latest information about house job. Because sometimes you could hear that this hospital is not coming out on this portal opening, or this other hospital is not coming out on this portal opening, or even just to know the dates for portal opening. So just, it's good to keep your ears on the ground, do you get? Because a lot of things are usually not, they don't usually come out how you want them to be. Do you get me? I always wanted to do my housemanship where I am right now. Do you get? And I'm grateful I got the opportunity to. It worked out for me. Do you get? It may not be the same for you. So just keep your eyes and ears open. And I wish you good luck on selecting a center for your housemanship. So when I first finished my surgery rotation, I asked myself, because well, I'm so into surgery, like I love surgery. Do you get? I asked myself if I should just finish my housemanship here after finishing surgery. Should I did do wrong? But well, you just have to finish in your entire rotation. Actually, you have to rotate through everything: surgery, pediatrics, medicine, O&G, and well, I'm currently doing my pediatrics rotation and I am in my last few weeks of pediatrics rotation. And the big question is, do I think I could possibly specialize in pediatrics? I don't think there's anything left for me to do in pediatrics. I have done my children emergency posting, I've done my newborn posting, and I'm still in the wards. I'm in pediatric cardiology, and it's beautiful here. But do I really think I want to specialize in pediatrics in the long run? Like literally, do I see myself doing pediatrics? Don't get me wrong, yeah, I loved pediatrics when I was in school. I don't know, for whatever reason, I had really beautiful teachers in pediatrics that were really encouraging, they were, inspiring, that kind of a thing, and they were ready to teach. Do you get me? But what I've seen so far, pediatricians, they are not the happiest set of people in Nigeria so far. I don't know about anywhere, but they are really not the happiest bunch of people I've seen. Do you get? I don't know what it is. It's just a feeling. Do you get? When I was in surgery, I had, do you get? They were just beautiful people. They were literally happy all the time. They were doing their surgeries and going on with whatever it is they had to do. Do you understand? And I don't know how to put it. There was just this aura about surgery posting. But entering pediatrics, I've met I've met the most unhappy bunch of chiefs in pediatrics. I'm not going to mention names. My chiefs are really beautiful, but like working in these different departments in pediatrics, I've met the most unhappy bunch of people. And I don't think I want to get into pediatrics, in all honesty. I hope my chiefs don't see this video, but honestly, I don't think I ever want to be or get to do a pediatrics in the long run, something like that. Or if I eventually leave the country and I want to maybe see how pediatricians are over there or how pediatrics generally is done over there, fine. But so far, eh, no, I don't think so. So apparently this week has been a lot. Do you get? It's just been from one thing to the other, literally. So I worked night on Sunday. That was my last day in newborn rotation, and I did nights. So night you have to finish around 8 a.m. and you don't leave until you hand over formally to the new people on call. Do you get? So I had to show them the ropes, give them a little introduction of how newborn actually is. And after that orientation, I was required to go back to my posting. Like on a Monday, we normally have consultant ward round and then CHOP, that's children outpatient clinic. And we have very limited hands, very few people to do CHOP. And you usually have up to 50 something patients coming to, and it's usually just chaos, usually in CHOP. And after doing that night shift, coming back home, like I was gassed. Do you get? I was completely tired, and yeah, I was still required to come out again for chop. Do you get? Because we have only one house officer, and it wasn't possible for him to assist my chief. Just one senior reg and one house officer seeing 50 something patients, if not more. I had to come out and help out in the children outpatient. And on Thursday, we had consultant ward round. Something terrible happened again. Well, technically, he's not our patient because he was referred out. He was referred to somewhere else, but well, he was still in the hospital and we're still affording him the care he needed. I don't know if you've ever gotten to certify someone dead ever as a medical doctor. Well, this was my very first experience. Well, we knew that his case was really bad. He was having um some acute rheumatic fever. He was being managed for acute rheumatic fever. Yeah, he was brought in into chair and later subsequently was moved into the ward. And we just recently did a 2D echo and we found mass pericarditis, and he was even getting into cardiac tamponade. You get the pericardial wall was very much thickened, and there was not much we could possibly do for him in this center, so he was referred to another hospital. But I don't know, there's just a lot of bureaucracy attached to the whole medical thing. Before you get to leave this hospital, though, irrespective of whatever it is your situation is, you have to pay bills. You have to, even to get the ambulance guy on the phone is like a very difficult something. Do you get? So I feel like all those factors just, it was really sad. Do you get? This 17-year-old boy at that. So honestly, it was messed up. Do you get? And I was in the ward. We came that morning to do what morning rounds, usual normal morning rounds, and he was gasping, the oxygen, like a lot of things were going wrong actually for him. And funny thing is that when we were doing the 2D echo, there was just the way he was talking. He was talking, "Oh, I don't want to die," and when a patient is in very severe distress, you get, there was really not much we could possibly do, you get, and giving our facilities and all of that. So my attention was called. He was depreciating. His vitals were so unstable. His respiratory rate was off the roof. And then we started resuscitation, started doing chest compressions, ambu bagging. Then, but he didn't make it. He didn't make it. He didn't make it. He didn't make it. And immediately after the event, yeah, after all the documentation and everything, you still had other patients to see. So we were still in the ward seeing other freaking patients. And the dad was, I don't even know how the dad was. He was just perambulating the entire place. And you could see that he was literally, oh God, I don't have words, honestly, but it was a very terrible experience for me. And after everything, the nurses called that, okay, you have to certify this patient dead and all of that. And I don't know, it was just messed up. Honestly, that Thursday was just messed up. And in the course of the rounds, yeah, what kept going through my mind was, oh, like his voice, as everything was going on, like he just kept saying, "Daddy, Daddy, just pray for me," all those kind of things. "Daddy, hold me." You get those kind of thing. The dad was always there, but he just kept saying, "Daddy, hold me. Daddy, God does not want to heal me," all those kind of thing. I don't know, honestly. I honestly don't know. Honestly, don't know the future of our healthcare system. Like, how can you or how can a patient be in that particular condition and be in a tertiary hospital, in a tertiary facility? You can't be able to help. You don't have the facilities to help the patient. Do you get? Okay, for the patient to be transferred to another place, it, no ambulance is ready. You have to pay heaven and earth in order to get that done. And honestly, it was very discouraging. Very, very discouraging. Generally, I would say this week was right from, in fact, for the past 3 weeks, I feel like I've been having really bad days in the hospital. Do you get? From newborn to my recent experience in the ward, it's just been really terrible, honestly. I can't wait to be done with pediatrics. That's the honest truth. I can't wait to be done with pediatrics. It's not just too emotional for me. It's just, I don't know, the rate of mortality rates is just something else. I can't keep up. I can't do it, honestly. As we round up, as we come to the end of pediatrics, I just really hope the next couple weeks, the next 2 weeks, be good. I pray that we don't lose any patients. We can only hope and pray at this point. In all honesty, I want to be in a place where we have every freaking facility to be able to help, and we actually do help. Because I feel that's the level of, or that's the level we should hope or to attain to be. You get what I mean? Yeah. So I think that's that. If you're new to my channel, do well to subscribe. I'm sure there are more beautiful things to come your way. You get, this is not just an experience, it's a journey. Well, it's also an experience you get. So I hope that you get to learn from my experiences, and yeah, you get to join me to yeah, on this journey literally. So we have roughly 20 something more weeks to go, and well, we've done 20 something weeks. I feel, let's look at it from that point of view. We've survived 20 something weeks, and I'm just joyful. Hopefully we get to do something really exciting maybe in the next video. Yeah, hopefully we get to go somewhere that is really nice and beautiful, and just ease off, shake off the stress, sort of. Yeah. And I'll get to carry you guys along. I think that will be all for today. I'm sure this video, well, not brought a smile to your face because I just shared something really heart wrenching. But well, do well to subscribe and hit the like button. And I'm going to catch you guys in the next one. Peace.